Welcome back to the show. Now, a serious turn. Breast cancer is the second leading cause of death in the United States among women, and mammograms, one of the ways to screen and get the best results if you get that diagnosis. We want to go ahead, welcome in Dr. Nicole Figueiredo to the show today. And let's talk a little bit about breast cancer, because I know that we're getting to Breast Cancer Awareness Month. And if you have not had that diagnosis in the family, chances are you know somebody who has. Isn't that right?
Unfortunately, that's true. We all have been touched with breast cancer within our lives. Unfortunately, it still does affect 1 in 8 women, which means that the average person has about a 13% lifetime risk of developing breast cancer.
And let's talked about, of course, how common it is, though, and no one likes to hear those numbers. When you do get that, though, diagnosis, I know sometimes you hear of the factors and you hear of all of the maybe genetic components of it. What do you see these days when, unfortunately, you do have to give a diagnosis to a woman?
Well, thankfully, due to advances in technology and improvements in treatment, the mortality from breast cancer has actually decreased significantly over the past several years, which is really very inspiring. And the thing that I tell my patients is that there are over 3 million survivors. And so breast cancer nowadays, if caught early, has an excellent prognosis. And we have several treatment options available to us that we didn't used to have. So the outcomes are better. But we strongly encourage women to get out there, get their screening mammograms, because they do truly save lives. If you're undergoing screening, you're going to catch those early changes, maybe even before they're cancerous, and prevent cancer. But if they are cancerous, the earlier you catch them, the better the survival is.
Would you say there are risk factors out there that women need to be aware of and men need to be aware of as they're living their life?
Yes, and thank you for making that point. Breast cancer does not only affect women, but also men. So it's important that we encourage the males in our family to get checked, and if they do find a lump, to definitely see their physicians. But yes, there are several risk factors. Some of those risk factors we can't change. However, there are several that we can change. And a lot of those are, dietary changes, exercise, things that we actually have control of. But some of those factors, just being a woman is the greatest risk factor. Your lifetime exposure to hormone is another common factor that we can't change. Family history. There are some families that have a strong history of cancer, including breast, and they may have a genetic component that could increase their risk. So it is important for women and men to talk to their physicians to assess their personal and family risk for breast cancer, and then try and identify how they should be undergoing screening. Do they just need an annual mammogram? Would they benefit from the addition of MRI or more frequent breast exams? Sometimes we even talk about doing risk-reducing measures for people who are very high risk, such as medications, sometimes surgeries to decrease risk. But most of us can help decrease our risk of developing breast cancer just by improving our diet, eating healthy, exercising, and avoiding tobacco, alcohol use. Those are things that we can do every day that would not only help prevent breast cancer, but other common diseases as well.
I'm so glad that you talk about those risk factors. But of course, let's get back. And I want to end this segment talking about the importance of mammograms. And you do hear different ages and when people should start those annual mammograms. What's the latest? What do people need to know about this important screening tool?
Well, unfortunately, I think all of the different recommendations has caused an area of confusion for most people. So I do strongly encourage patients to talk to their physicians, again, like we said earlier, to assess their personal risk. Some people of higher risk may start their screening with mammogram, MRI, or ultrasound earlier than others, in particular if there's a family history of breast cancer, or if they have a personal history of abnormal cells or a genetic predisposition for cancer. However, for the general population, we still recommend that you consider starting your annual screening mammograms at the age of 40. And that you continue that annually. There are different recommendations about whether you need to do that every 2 years, when to begin, when to stop, but that's really needs to be individualized for the patient. In my practice, I still recommend that my patients get a mammogram every year, starting at the age of 40.
And of course, we're so thankful that AdventHealth is getting the message out there today. Schedule your mammogram today, or schedule your mammo today.com is where you can go for more information. And I want to bring you in one more time, because I know there's even a special offer in the month of October, which is Breast Cancer Awareness Month, that you want to have people take advantage of taking a mammogram and that important screening tool, right?
Absolutely. There's no reason that anyone should go without their mammogram on an annual basis. And AdventHealth is making that possible for all women and men who need it. Our women's centers are offering mammograms for $30 at all of our women's imaging centers. So please get out there and get your mammograms, and make sure you follow up with your physicians.
And just one more time, here's that important information. Thanks for being with us today.